Okay, here we go. Hi, Paul Sakis, Good News Broadcast, speaking to Dr. Perry Fine. Hi, Doctor. How are you?
I'm great. Good to be with you.
Good to be with you, and I'm feeling all right today, and then that's good. But the doctor here, he is involved with the American Pain Foundation, and we're going to talk about some back pain and maybe how to understand it and cope a little bit better with it. Thank you for doing this. So welcome.
Thanks, and Paul, I'm so glad you're feeling good, and but I'll bet you know, and I bet everybody out there who's listening either has or knows somebody who's got some long-standing problems with chronic low back pain. It's a really common problem affecting upwards to 26 million or more Americans. So it's something that really does need some serious attention.
I agree. I definitely agree with that. Actually, I'm becoming a yoga instructor, and as part of the instructors, we need to give alternate exercise, postures. So and suggest, maybe not, put your feet up into the air, foot to sky. And
that's fantastic actually, because there's a number of different therapies, treatments for back pain, and some are things we need to do ourselves. Others we need under supervision that are medical therapies. But yoga, everybody thinks yoga is sort of turning yourself into a pretzel, and it turns out yoga can be anything from very gentle to pretty extraordinary kinds of activities. But it's certainly, in one form or another, one of the better self-directed kinds of exercise programs that people can undertake to help themselves with, in terms of their chronic low back pain.
But once again, like and you're more of an expert than me, is that you need to be wise, because if you're raising your feet and that's going to put more pain into your lower back, then obviously you're not probably doing something that's helpful for yourself. So, like, how about golf, okay, or skiing? If you're turning sideways, is that good or bad?
Well, let me refer people to a website, partnersagainstpain.com.
Okay, I'm going to open that up. All right, good.
And on that website, again, partnersagainstpain.com, there's a section on understanding and coping with low back pain. And people can find a whole number of a variety of things that will help inform them about things they can and should be doing, things that they should take a little bit of caution about. But the main issue really is to know that if you've got chronic back pain, you deserve good care. You should seek an understanding of what is going on with your back from somebody who's going to work with you, that is a healthcare professional who's going to take this seriously with you, enter into a partnership with you to help you get the care you need. And it starts with making sure that there's not something seriously wrong and a structural problem that might really need relatively urgent medical attention. The good news is that's very rare. Most of the time, for most people, what they really need is instruction on what kind of exercises and stretching and self-directed approaches to care they can do. They may need some medication management, and if that's the case, again, under supervision, using those medications only as directed. Maybe there's a role for some physical therapies, some injection therapies in certain very specific circumstances. So a whole variety of things that people can and should seek out and consider doing. But again, working in partnership with somebody who knows all the options, who knows you, who's going to take a good history, good physical examination, understand what the issues are, and work with you to optimize your back care.
Now, Partners Against Pain, I am looking at this website. Tell us a little bit about that. What I see here: educational assessment, documentation, resources, links, pain advocacy. A lot of information here.
A lot of information, and the section on understanding and coping with low back pain has a section on strategies for a healthier back. It's what you can do to ease low back pain. Again, the kinds of questions that you should come prepared to be asked, and to sort of coach in a way your healthcare professional to ask you, and again, enter into this active arrangement. A lot of people do experience, they go into a doctor's office as soon as they recognize there's nothing, that they think is a serious medical problem. It's just quote, pain, unquote, and they feel, sort of, rebuffed as if that's not a serious problem. Well, that's wrong. People really do deserve care. Pain and chronic pain takes such a toll on people's lives. It interrupts with your sleep, your work, your social interactions, everything that means anything to us. So it does need to be taken seriously. We should expect that our healthcare professional would want to work with us to figure out ways to improve our the quality of our lives with it. And so that's an expectation that I think listeners should have.
You know, I grew up in the shoe business, selling shoes, and I see here understanding and coping with low back pain. Okay, and I wear some orthotics, and I'm flat-footed, and I have my challenges, and have been dealing with that for a long time. And it says good footwear is important. So, what do you think about that, Doctor?
Very important. When you're standing up, our contact with the good earth beneath our feet is through our shoes, and there's a lot of attention to shoes and fashion and what looks good, and of course what feels good is probably more important. But all that said, there are fashionable shoes that, in fact, fortunately these days can also be good for us. And, these need to be fitted well. And of course, people who are on their feet a long time, either moving around or especially people who are standing still, that puts a lot of stress on the back. And so good posture, good footwear, this is all, part and parcel of good back care. And so if you're having chronic low back pain and you've never considered what the influence of your footwear might be or where your posture is, this is something that a good physical therapist in association with your doc can refer you to, can help assess and evaluate how you're doing and give you some good advice in that way.
And a healthy body weight, it says. Your strategies for a healthy back. Maintain a healthy body weight. There's one right there, right?
Right. Well, everybody probably gets tired of hearing about diet and exercise, but, it is such a fundamental thing. Heart disease, back pain, diabetes, all those things we hear about, maintaining a healthy body weight, good diet, regular exercise on an every day, and again, some combination of stretching and strengthening, no matter what your age is, from the very young up until the time that we breathe our last breath. There's always something we can do to sort of optimize our functional abilities, our fitness, and from that translates into the quality of life. So the first place we need to look is inside ourselves, what we can do, but then again in partnership with a healthcare professional, make sure that we're sort of on track.
Tell us something about the American Pain Foundation.
Well, this is an organization that's been operating for several years and was established with the recognition that there was a lot of both acute and, that is, new onset and chronic or persistent pain out there, and that it was really not being well attended to. That pain was oftentimes looked at as a symptom of disease, and then once that disease was diagnosed, people stopped thinking about pain as a problem. But as it turns out, people with chronic pain, takes a serious toll on their lives, and they need help and good understanding and good care to prevent their lives from being deteriorated by painful conditions. And so the American Pain Foundation is out there to advocate for good care, for research, for a good education and teaching of healthcare professionals, and overall to improve awareness of these problems and get people the help they need.
Are there more pain management centers being open? I know of some in like hospitals and all around. Is that becoming more of a prevalent?
Well, pain medicine is developing rapidly as a specialty, as we recognize that pain is a part and parcel of a lot of different diseases, anything from cancer to diabetes to issues around fibromyalgia, chronic low back pain, as we're talking about today, headache. It's a big issue and a big problem in our society. So pain medicine is becoming a developing specialty. The issue I think we really face is drawing adequate attention to the legitimacy of pain as a problem. And I think it's a big public health issue that we have to address to make sure that insurers are paying for the coverage and the care that people need, that we're doing enough research to improve upon our understanding and prevent pain and get pain treatments. So a lot of work being done right now, a lot of very exciting developments in the works.
Okay. What do you believe in thought is on oxidation of an area in your body? Do you think you can literally think the pain in the back, think hard and say, bring the air flow into that area?
Well, I'm not so sure about that from a on a scientific basis. I certainly think that we know that tissues and healthy tissues need good blood supply and clearing of so-called metabolic waste. That is, the products our bodies and our muscles create. We got to be able to get rid of them, and blood circulation is required for that. And healthy heart, healthy liver, healthy kidneys, and liver all do that. Bringing oxygen to those tissues is the other side of the equation, and of course, without oxygen, we don't have life as we know it. How we direct those specifically, again, I think just good exercise, good technique. There's a lot of work now with mindfulness therapy to try and help people to use that extraordinarily powerful organ we have between our ears, our brain, to influence our physical conditions more and more. So a lot of research in this area and sort of interesting development.
Perry, you're out in Utah area?
I'm with the University of Utah. That's where I've been in practice now for 25 years.
I did a show with a doctor who did an alternate kind of, he was a surgeon, and he did the rodeo circuit on the weekends.
Oh, really?
So people put their bodies through some pain situations as well, right?
Rodeoing is a tough one. Oh man, yeah.
And so on a Monday morning, the Monday morning football player, the Monday morning rodeo-y, what do you think they should be thinking?
Well, I actually worked with the University of Utah football team for almost 20 years as a sideline trauma doctor with them, and I think between rodeoing and football, that's about as brutal as you can get. These are recreational things, or sometimes it becomes people's passion and profession. If you're into a body contact type of sport or activity, then the main thing is to become as fit as is possible. I mean our bodies, we can't rebuild them. They only age in place. So the more we can do to stay fit, again, focus on good diet, stretching before we get into activities. But you'll see any professional athlete, any college athlete, any high school athlete these days knows that. And fortunately, the coaching behind that has gotten much better. I think that the information has been brought forward and to try and limit injury and limit the kind of problems. However, in these body contact sports, we're really creating a lot of impact and force against our knees, our hips, our backs. And so this is a source of what's called chronic traumatic arthritis, when joints and bones become injured along the way. And this can become a problem lead to chronic problems over the course of time.
Where's your pain in your back? I'm going to ask somebody just in my office, where's your pain in your back? Well, my buddy, my main guy here, Austin, has some pain in his back. He's going for some physical therapy. What kind of pain is it, Austin? Tell me. I have a doctor on the phone. Do you have to go to another interview right now, Doc?
We're just about probably ready to move on here.
He's ready to move on. Okay, I just had wondered. Should he be just one quick last question? Ice or heat? Depends.
Depends. There's sort of a rule of thumb is acute injury, brand new injury, ice in order to reduce swelling and reduce inflammation. More longer standing problem. Sometimes people think heat to improve blood flow, loosen things up. But it turns out there's a lot of individual variation. Some people find icing their low back, if they've got chronic low back pain, is very, very helpful intermittently. Others heat, others alternating. You're not going to hurt yourself as long as you make sure the temperature is not excessive in terms of heat, or you're not going to freeze your skin.
Doctor, you have a lot of good, sound, solid, logical advice. Thank you very much. Last question: what's good news for you?
What's good news for me is, really the opportunity to share everything I've learned the last 25 years and to try and get good information out to folks so they can get the help they need. And again, partnersagainstpain.com website is a great resource.
Fantastic. Great job. Thanks so much, sir.
Thank you.
All right. Bye-bye.